Guess it's on. And I'm just going to go ahead and start. So, hi, everybody. I hope everyone can hear me. My name is Ibrahim Camara, and I'm your host for this session. First of all, I would like to thank Venetia and my good friend Danny and the whole team of the Tropics Business Summit for inviting me to this beautiful African event. I'm also proud because this event is led by women, and this is an actual proof that in Africa we have strong women. Once again, I'm Ibrahim Camara, your host for the next few minutes. I'm the managing partner of ATSI, based in the US, and ATSI stands for African Technical Support for Implementation. ATSI is based in Washington, D.C., and in Côte d'Ivoire, precisely in Abidjan. However, ATSI can provide you with support in the whole West Africa and in Central Africa, but at the moment only in the DRC, in the DR Congo. ATSI was funded by 3 international development professionals and focused on providing financial management services, procurement services, monitoring and evaluation support, and also human resources support. If you are an international development companies who need to hire a staff with a huge international development background, you can definitely reach out to us. ATSI can also assist you with the in-country registration process and with anything that is related to project startup and also closeout activities. I have to say that the founders of ATSI, all of us, it's just 3 of us, have each under their belt over 10 years of experience, and we have decided to create this company because we wanted to respond to the quick needs of international development companies implementing projects in Africa. So without further ado, I will jump right into the topic of this session because we only have a few minutes. International development and the private sector in COVID-19, the current state of the funding for the fight against the COVID-19 now and in the future. So it is good to remind people that international development plays an important part in the private sector. The novel coronavirus drastically impacted both sectors. It is also important to remind everybody that when one talks about the implementation of a particular program or project in international development, it is not only limited to provide healthcare services to the population. It also includes a component that will have an impact on the private sector. I'm saying that because the way people picture international development is they only usually represent this as seeing doctors going to help people who are in need of healthcare. But no, that's not only what international development does. Every single funding provided by a donor includes a line item budget that will have to go directly to the private sector. And example, if you're implementing a malaria campaign, you will need to conduct a spraying campaign and hire more than 100 of sprayers. Therefore, you will need transportation for these workers, these sprayers, to move them from one village to another village. Consequently, you will have to enter into a contract with an actor of the private sector, let's say a car rental company, and that particular company will have to go through a selection process. And the selected car rental company will benefit from the funds that were obligated initially by donors, either USAID, the Gates Foundation, or the World Bank. And this will definitely create jobs, wealth, and also increase the revenue of this particular car rental company. Another example are the airlines company. If you are running a project in a very big country like the DRC, or if it's a regional project, let's say in West Africa or Central Africa, it is obvious that you will need to travel by plane and purchase several plane tickets, either on a monthly or weekly basis. Therefore, we can see that this will have a huge impact on the airline industry in that particular country or in that particular region. Therefore, international development is injecting capital into the private sector. And we definitely understand that the travel bans, the lockdown, and the trade interruption took an increasing toll, not only on the international development sector, but also on the private sector, because it did affect their revenue it reduced their earnings, and it also forced some of those companies to actual bankruptcy. So still on the same topic, and do not get me wrong, the private sector and the international development sector have also collaborated together in order to come up with integrated solutions for an immediate response and a long-term recovery against the COVID-19. We have the British diagnostic company, which is called Mologic, MOLOGIC, who has been working with the Institut Pasteur in Senegal in order to develop a COVID test and an antibody test. And the goal was to create a diagnostic kit made in Africa that would include two components, a saliva test and a blood test. It is also important to mention that that particular British diagnostic company was funded by somebody who actually participated in the creation of the first home pregnancy test. So we can definitely see that Africans are willing to raise the bar by collaborating with big pharmaceutical firms in order to beat the COVID-19, and at the same time to develop a product that will be affordable for its own people. Because the actual goal of was to sell these kits for less than $1, which is the equivalent of maybe 500 CFA. Another example of collaboration is the digital tracking, and I will take you outside of Africa, but we'll come back quickly. I'm going to take you to East Asia, precisely in Taiwan, Singapore, and South Korea. So these countries are actively deploying technology to collect data on the virus progress and effort to contain it. And in those countries, the installation of tracking apps on smartphones have been mandatory, and these applications exchange Bluetooth signals between mobile phones. In South Korea, private developers worked hand in hand to develop apps that supplement official government tracing efforts, which many have found insufficient. And these apps were actually downloaded over 1 million times in just a few weeks by the Koreans, according to MarketWatch, which is a famous website that provides financial information and business news. And that website is a subsidiary of the Dow Jones Company. And guess what? Several African countries have also been rolling out tools to aid contact tracing. Nigeria was planning on deploying GlowIPID, a service that achieves contact tracing by leveraging Bluetooth and device GPS location technology. When a citizen is confirmed with COVID-19, the data is actually transmitted to the NCDC, which is the Nigeria Center for Disease Control, who then identify the people who have been in contact with the COVID-19 person and sends a push notification to them in order to inform them. And Ghana also rolled out a similar contact tracing application using mobile networks to track and trace people and defines hotspot to model and contains the actual outbreaks. Still in Nigeria, but on a different type of technology. Because of the numerous amount of phone call received related to COVID-19, the NCDC, again, the Nigeria Center for Disease Control call center, improved its call center capacity. And it did develop an artificial intelligence-powered interactive voice response system that can communicate with thousands of callers at the same time and disseminate correct information from the center, as well as passing on callers' queries to the NCDC to act on swiftly. And another thing is that within Africa, we have noticed that health technology startups investors are currently backing up e-health ventures because they believe that Africans can definitely contribute to the fight against the COVID-19. Finally, in regard with funding, it is important to mention that several multilateral and bilateral donors are making billions of dollars available in order to tackle the coronavirus. USAID made $20.5 billion available to fight the coronavirus. And they have done so for Ebola, HIV, malaria, and tuberculosis. And so far, USAID has spent about $1.6 billion in the fight against the COVID out of those $20.5 billion. And a good amount was definitely devoted to Africa. The Global Funds also has provided more than 1 billion to support countries through direct funding and grant flexibilities, allowing countries to use up to 5% of an existing Global Fund grants that was previously attributed to fight the COVID-19. And the Global Fund is also urgently seeking 5 billion to continue the fight against the COVID-19, because it's something that they really want to they really want to become a part of this fight. And the World Bank also pledged to make available 160 billion to help developing countries. And it's important to mention that so far the World Bank emergency operations has reached about 100 developing countries, which are home to about 70% of the world population. So this is it for my contribution. And I don't know if you have questions, but if you do not have questions, you can definitely reach me via LinkedIn. All my information are on the Tropic Business Summit website. And once again, I would like to thank the entire team for this opportunity, and also for listening to my modest contribution to this summit. I hope you enjoy my intervention, and let me see if there's no question. If there's no questions, then you may have a blessed day. Thank you very much.